So I recently did a poll on my Instagram stories, and a whopping 67% of my followers gave IUDs an A. I was a bit blown away. IUDs worldwide are the most popular form of contraception. In the US, IUDs are third, behind female sterilization and birth control pills. So let's talk IUDs. IUD stands for intrauterine device. They are a T-shaped device, a little larger than the size of a quarter, that, once placed, sits inside the uterine cavity. IUDs are 99% effective. They are an example of LARCs, long-acting reversible contraceptives. So categories of IUDs. There are hormone-releasing IUDs and non-hormone-releasing IUDs, or non-hormonal. Hormone-releasing IUDs include Lolita, Kyleena, and Mirena. The non-hormone-releasing IUD is the Paragard. Depending on the type of IUD you have, it can stay in place for 3 to 10 years. So let's talk about the progesterone-releasing IUDs and how they prevent pregnancy. They do that by thickening cervical mucus to prevent sperm from reaching and/or fertilizing an egg. They make the lining of the uterus unfavorable for implantation by way of thinning, and they also partially suppress ovulation. Added benefits of progesterone-releasing IUDs. They can be removed at any time with a quick return to fertility, and they can also be used while breastfeeding. Outside of contraception, they can be used to treat heavy periods. In a nutshell, progesterone thins out the lining of your uterus. Hence, you don't bleed as much when you get your period. On the flip side, irregular bleeding or spotting can be an annoying consequence of progesterone-only types of contraception. Most of the brochures will tell you that post-IUD placement, irregular bleeding can last 3 to 6 months. In my clinical experience, I think it's closer to 6 to 8 weeks. The copper IUD. The copper IUD prevents pregnancy because the copper material creates a hostile environment for sperm, thus preventing sperm from finding the way to fertilizing the egg. Highly effective as an emergency form of contraception, copper IUDs are. If placed within 5 days of unprotected sex, copper IUDs are 99% effective in preventing pregnancy. This particular IUD can be associated with heavier, more painful periods. So some common questions that I get about IUDs. Is an IUD right for me? Most women are candidates for an IUD. If you are in a mutually monogamous relationship and are at a low risk for contracting a sexually transmitted infection, you are likely eligible. Long gone are the days where we used to think that IUDs were only for women that had previously had babies. Not true. Do IUDs prevent STIs? No. If you are not in a mutually monogamous relationship, it's important to use a condom, and this applies to any other form of contraception. Barrier contraception, such as condoms, are what help prevent STIs. How is an IUD put in? Easy. The setup for an IUD insertion is pretty much like a pap smear. You go see your OBGYN, we insert a speculum much the same way we do when we do pap smears. We clean your cervix off with a betadine solution. We grasp the cervix with a single-tooth tenaculum. Most of the time, I distract patients when I put this on by having them cough. We sound the uterus with a certain instrument to detect the length of the uterus, and then we insert whatever type of IUD you've selected. It's pretty straightforward. I typically recommend that patients take a non-steroidal like Aleve, ibuprofen, Advil 30 minutes prior to insertion. So is IUD placement really that bad? It depends. I read an article discussing pain associated with IUD insertion and doctors not giving women a heads up, so to speak. I think knowing is half the battle. It's important to explain the procedure so that you, women, know what to expect. I prefer to insert IUDs when you're on the tail end of your period. It's not a prerequisite, but I do think that it makes it a lot easier. I have had some patients become lightheaded, dizzy, or a little crampy post-insertion, but most do fine, and it's nothing that a cold compress, a glass of water, and some reassurance won't cure. So this is the big thing, making sure that you are aware of what to expect before, during, and even after the procedure. So what's it gonna be for you? IUD, yay or nay?
you.